Hey, ladies and gentlemen, my name is Ernest Yegha, and this might not be the perfect place to make this video right now, but because I'm in my car right now, but just bear with me. With all this coronavirus thing going on, I think this is kind of the perfect place. The safest place for me to make this video. But the most important thing right now is the message that I'm about to put out there. For people to understand what this word is. This word I'm about to say. It's kind of a complicated word because I have never heard about this. Okay, it's botulism. So it's I've heard about so many diseases, but I've never heard about botulism. So it's kind of a big word, but to simplify this big word, botulism, to an ordinary person, botulism could be a type of food poisoning that paralyzes the muscles, and it is triggered by botulinum toxin. It's those are like scientific names. Botulinum toxins. By the way, Professor Malo, I do admit that this was a difficult topic. All right, so it is triggered by botulinum toxin, which is produced by a bacteria called Clostridium botulinum, found in the soil or the water, and this could be found all over the world. It doesn't matter. So the types of botulism infections that we might encounter, it's food-borne botulism, food-borne botulism. So, which could come from eating foods that contain the botulinum toxins, and we are talking most especially about canned food. Canned food. So the second type of botulism is wound botulism. So, and the bacteria Clostridium botulinum could be found in a wound, which leads to the creation of toxins that could be harmful to the body. And the third type of botulism could be the infant intestinal botulism. So an infant might consume food that contains the spores of the bacteria Clostridium botulism, which could lead to the growth of this bacteria in the baby's intestines, and this could kind of further lead to complications in the baby's belly. So the last type of botulism we're going to talk about is the adult intestinal botulism. So when adults go through abdominal surgery procedures, and if they are not really careful by practicing great hygienic procedures, or following the doctor's instructions, they could be the bacterial Clostridium, botulinum infections in their abdomens, and this could create infections in their body. So, we've been talking about this botulism thing, but it is important to know the causes of this, of botulism. So, what are the causes of botulism? That's a very important question. What are the causes? So, the bacteria Clostridium botulinum could be found in the soil and untreated water, dirty water, or even swamps. You know, just like some microorganisms, this bacteria will produce spores, which will further develop in canned foods, especially number one, and where toxins are produced in these canned foods, and that's where they just settle down. And when humans eat these foods, when they eat disinfected canned foods by the bacteria, it could lead to food poisoning. And the type of food that could inhabit this bacteria is canned foods or canned fruits and vegetables, as we mentioned earlier, smoked fish and raw fish, and also corn syrup, and so on and so forth. So the next thing we're gonna jump right into right now is the signs and the symptoms of botulism. So when we talk about the signs and symptoms of botulism, what are we really talking about? we're talking about the physical signs, the physical aspect, how this infections might start manifesting in your physical body, or internally. And it really doesn't matter the form or shape through which you get botulism, because the signs and symptoms will always be the same. So some early symptoms might include, double vision, difficulties in swallowing, and we could also have shortness of breath, vomiting, belly pain, and diarrhea. So not to forget about the fact that it might lead to difficulties urinating, and finally constipation. And constipation is the last thing you want to think about, because I remember myself, when I have when I get constipated, it stresses me up, because I know the pain that it comes along with. But um but the most significant symptom is the pain that you start experiencing in both sides of your face, and which could be passed on to down to your neck, and also the rest of your body might be affected by this infection. And infected babies could experience symptoms like poor muscle tone, or poor feeding, or weak crying from babies, and drooping, and so on and so forth. So, what are the diagnosis and treatment of botulism? So, we're gonna start first by talking about the diagnosis of botulism. So, doctors would usually, diagnose botulism by checking symptoms such as muscle weakness, if you're experiencing a weak voice, and the doctors might be interested in your personal diet as well. Diet is one of the most important thing in this disease that we're talking about. Not just botulism, but also many other diseases that are being caused by microorganisms. So, in babies, the doctor could be interested in knowing if the child has been exposed to honey. You know, honey is a very, in fact, important factor. Or if the child has been showing, sluggish behaviors, and or has had constipation recently. So the doctor could further analyze aspects like blood, stool, and vomiting to detect the presence of the bacteria or toxins in the body system, in the human body system. So the last thing we're gonna jump right into is the treatment of botulism. So in case of botulism caused by foodborne or food poisoning, the doctors might prescribe medications that will cause bowel movement, and the aim is to clear the stomach. When you to clear the stomach, or cause vomiting of the patients, and this might help evacuate all those infections, or bacteria in the body system. And in case of for wound cases of botulism, the doctor might remove infected tissues through surgical means, which is something you think of as a last resort. Doctors could implement antitoxins as well, which gets into your body system and neutralizes the toxins to prevent it from creating further damages into your system. For wound cases, antibiotics could be prescribed by doctors as well. So, but for patients who have problems breathing, and for patients who have problems breathing, a mechanical ventilator could be implemented to help patients, suffering from this disease called botulism. And also, the last thing we are going to mention is rehabilitation could also help patients improve their speech and body movement, in terms of getting better and staying healthy. So, thank you, ladies and gentlemen, for listening to this session. And by the way, Professor Mahler, I want to admit that this was, I would say, the most difficult topic. And but it was a pleasure for me to research about these things and bring it out to you. But I'm gonna post the slides for you, and also to my classmates in case they're interested in knowing about this weird name disease called botulism. But it was a pleasure, doing this presentation. Thank you.